Okay, today we're continuing on with completion of the dental treatment unit. Ms. Gonzalez is going to start by flushing the line, and what she's going to do, she's going to show you that she has to bring the arm all the way forward for it to work. She'll step on the rheostat, and she's going to flush it for 20 to 30 seconds, okay? And she's holding a paper towel so that it catches any oil, water, debris, anything that comes out, she catches is in the paper towel, okay? She's going to throw that there. Then she's going to make sure that if she had any sharps, she would go over to the sharps container under the sink, and if you don't mind pulling it out, Ms. Gonzalez, okay, she would dispose of any sharps there, okay? All right, thank you. Okay, the next step after she does that is she's going to start removing the barriers. She's going to invert the headrest cover and start putting all the barriers that can fit in there. She's going to start putting them in there. So she'll take the barriers off of everything: the mouse, the lights, the control panels, the suctions, the view box, the exposure button, the radiology barriers. And notice how when she does that, she holds the light, because you always want to make sure that you don't bring the light down when you take those off, okay? She's actually, by inverting the bag, she's saving a lot of time, a lot of going back and forth, because she's putting it all into like the little trash can. She is using the same gloves that she used when she was in the procedure, because it's the same dirty germs that she's taken off, okay? So the barriers, she's taking all that off. It's the same germs, okay? And she's gonna be going into cleaning, which would be the next comp that we'll talk about, okay? But everything else, the water tip applicator tip is not disposable. It's silver, it's metal, so we don't throw that away. Anything that's disposable, we will throw away. If you have any questions on whether you should throw it away or not, always ask. Always, always ask. It's better to ask than to do the wrong thing. That goes for here in our dental clinic and also at your clinical site, okay? Always, always ask if you're not sure. The assistants are always willing to help, okay? Okay, the next part Ms. Gonzalez is doing is she's taking all the barriers off.
This is a much larger bag, so what I'll do is I'll go ahead and use this to complete putting all the barriers in here.
Okay, and she took it off the tube head. Taking off the tube head, the exposure button, the control panel.
So now I have a much larger bag.
She closes it. She's still going to come back and clean it, but she closes it so that she doesn't bump into it, or the doctor doesn't come back in and bump into it. Notice how she's curling everything so that no debris falls, just like she did with the bib. And just putting it all in the bag. Now the next thing she would do is we would take all our trash and the tray over the sterilization room. All the barriers have been removed. Okay, so we'll go to the sterilization room. Okay, and here we're going to dispose of anything that has secretion, blood. Biohazard goes in the biohazard box here. Also the gloves would go in there after, but we remove of any of the paper towels, anything that may have blood or saliva goes in there. Okay, she presses down at the bottom. It's going in, the dirty tray is going into the red unit. Okay, she's going to remove her gloves. If you don't mind, one more time, just showing us how to close that the door, Claire, the little cabinet. She pushes down here, and sometimes you gotta put it really hard. Okay, then she's gonna wash her hands, because the next part again is when we go do the next step, it's going to be to put on utility gloves. So Ms. Gonzalez is washing her hands, and then we will put on utility gloves.